Around 3,000 out of hospital cardiac arrests occur in Singapore every year, and 1 out of the 3 of the casualties are women. Unfortunately, women are less likely to receive timely CPR and AED because many men are afraid that they will be accused of molestation or sexual assault if they touch a woman's breast or injured her, especially when she is a stranger. But with every minute that nothing is done to resuscitate the casualty, chances of survival drop by 10%. So, do not hesitate. Just remember DRS, A, B, C. D. Check for danger. Check for danger before approaching the casualty. Make sure that the scene is safe. R is for response.
Hello, are you okay?
Tap firmly on the casualty's shoulder and check for response. S. Shout for help. Ask someone to call 995 for an ambulance.
No response. Priscilla, call for ambulance 995. Get AED.
Okay.
But if you are alone, call ambulance 995 and follow the dispatcher's instructions. A. Ask for an AED. The My Responder app helps you to locate the nearest publicly accessible AED from your location. B. B is for breathing. Look at the rise and the fall of the chest to check for normal breathing. This should not take more than 10 seconds. For healthcare personnel, check for the cardiac pulse and breathing. C. C stands for compression. Start chest compression if the casualty is not breathing abnormally, or when you are in doubt. Kneel with knees slightly apart, interlace finger and lift them off the chest wall. Place the heel of your hand on the lower half of the sternum. Position your shoulders directly above the casualty's chest. Straighten both elbows, lock them in position. Ensure that you compress about 100 to 120 times per minute. Each compression about 4 to 6 centimeters deep. After 30 compressions, perform 2 mouth-to-mouth ventilation. Perform head tilt chin lift to open the airway. Pinch the nose and give 2 breaths, just enough for the chest to rise. If chest does not rise after first ventilation, reposition the casualty's head and reattempt to ventilate. Continue chest compression if second ventilation fails. There are over 10,000 publicly available AEDs in Singapore. You can find them in many public places, and anyone can use AEDs to save lives. Use a solid or sharp object like a key or a pen to strike confidently at the center of the glass on the AED cabinet to break it and retrieve the key. Do not use your bare hands. When the AED arrives, check the area for wet surfaces, metallic surfaces, and flammable gas before you use the AED. Always continue CPR until the AED is ready to analyze. Turn on the AED and follow the voice prompt. Put on your glove, shift any jewelry to the side, cut the side of the casualty's shirt and pull up her bra slightly. Remove any medical patches and wipe dry the chest, ensuring that the chest is bare, dry, and clean. Apply the AED pads firmly onto the bare chest according to the diagram. One on the lower left below her left breast, and the other on the upper right chest under the collarbone. If the casualty has a pacemaker below his right collarbone, you have to place the AED pads 4 fingers away from it. Cover up the female casualty's body as soon as the AED pads are placed. Continue CPR until the AED prompts.
Stop CPR, stand clear.
At this point, ensure that no one is touching the casualty during the analysis. When AED prompts,
shock advised.
Shout,
Stand clear.
Shock delivered. If needed, start CPR.
Continue chest compression after shock is delivered. Second rescuer can take over the chest compression. If AED prompts, no shock advised, continue chest compressions. Only stop CPR when the AED is analyzing the heart rhythm, casualty wakes up and regains normal breathing, or when the paramedics take over. Remember, immediate application of CPR and AED can raise survival rates as high as 60%. You have the power to save a life.